response to the coronavirus epidemic in America. And by that, the President made clear when he asked me to lead the White House Coronavirus Task Force, not merely a whole federal government, but a full partnership with state and local governments across the country. And today we renewed that with our latest conference call with governors all across America. We've met with them today specifically to speak about the progress that our governors are making, expanding testing across the country. And we were pleased to hear about the extraordinary and rapid progress that governors are making. At the outset of the call, where we had more than 50 of our nation's governors, we, of course, had people under a FEMA report on progress. More than 35,000 National Guards stood up, 5,000 active duty military deployed in 10 states. And we were also pleased to report that FEMA, HHS, and the private sector have coordinated the delivery of shipments to states around the country, including nearly 67 million N95 masks, 105 million surgical masks, surgical gowns, shields, gloves, more than 10,000 ventilators, and more than 8,000 federal field medical station beds. Beyond the report that we provided to the governors, we assured them that at the President's direction, this is one team, one mission. And we made it clear to the governors that we know we're all in this together. And the partnership that we have forged together really begins with mitigation efforts. It moves to making sure our healthcare workers have the support they need, but also testing is in the forefront of all of our minds. We're working to make it possible for every governor to access the existing capacity to enable our states to be able to reopen responsibly under the phased approach that the President unveiled 1 week ago. A little bit of context, you may recall that 1 month ago, all of the testing that had been done in America, 80,000 Americans had been tested. But as of this morning, 5.1 million Americans have been tested for the coronavirus. A quick reminder to our fellow Americans, and this was something from our scientists today at the task force, we reminded governors of this as well, that as testing increases dramatically across the country, cases will increase as well. But people should not be discouraged by those numbers. We are looking at very positive trends in hospitalization, in emergency room entrances, and we continue to see, as we've said at this podium, every day over the last several weeks, we continue to see positive progress, not just on the West Coast, but even where the coronavirus epidemic has most deeply impacted in areas in greater New York City area, New Orleans, Detroit, and elsewhere. On our nearly 2-hour phone call today with those governors, we heard of the progress governors were making in implementing the resources that we've been working to provide them, not just the medical equipment, but also, as you recall, that map a week ago that showed where all of the equipment is all across the country in all 50 states. Governor Cuomo joined us for the call today. He spoke favorably of his meeting here at the White House, Mr. President, and his recognition that testing is a partnership between the federal and state governments. As Governor Cuomo said today, he understood that the federal government works with national manufacturing and supply chain, and the governors deal with the labs to expand and implement testing at the state level. Governor Cuomo also explained how he's using his licensing authority as a governor to stand up the more than 300 labs that can do coronavirus testing in the state of New York. And we congratulated him for his leadership in that and urged other governors to use their authority similarly. In Tennessee, Governor Bill Lee told us that he's deployed the National Guard to stand up more than 20 drive-through test sites. They're testing 10,000 people a day. They've already tested more than 130,000 people in Tennessee, and they expect to surge another 15,000 people in testing sites this weekend in Tennessee. Massachusetts and area we're continuing to watch very closely as cases have not yet stabilized. And Governor Charlie Baker, after he thanked us, Mr. President, for the Army Corps of Engineers deployment of 4 field hospitals, he described how they have rapidly expanded testing all across Massachusetts. We commended him for that. In the beginning of March, he said they had just one testing site in the state of Massachusetts, and now, thanks to Governor Charlie Baker's team, they have more than 30 testing sites. Minnesota Governor Tim Walz reflected on the call today about the partnership he's forged with the Mayo Clinic, the University of Minnesota, and the State Health Department. Are actually collaborating to perform 20,000 molecular tests and 15,000 antibody tests per day. And I'm looking forward to traveling to the Mayo Clinic in Minnesota on Tuesday of next week to learn firsthand from the governor about their efforts across the state to expand testing. Iowa Governor Kim Reynolds gave us an update, Mr. President, on her progress. She's literally tripling testing capacity in her state through a partnership with the private sector, with the University of Iowa and Iowa State University. She also launched the testiowa.com website, which actually creates an access point for people to fill out a questionnaire about whether or not their symptoms or